The first year or two of COVID, when we just really didn't know what was going on, it was precarious. They didn't want us coming into their home and exposing the rest of their family. And so we had to do telehealth, and it was necessary.
Hey everyone, this is Theo Harvey, and once again, welcome to Medical Practice Success Secrets. This is the podcast where we go deep into the changes happening in healthcare and bring on the experts that can help you navigate the new normal of healthcare. On the call today, I have Nurse Erica. Erica, thank you for joining the podcast today.
Thank you for having me.
Awesome. So if you don't know Nurse Erica, she is using her social media platform to advocate for systemic change in the healthcare industry. It's been truly inspiring because she goes around the country talking to nurses, advocating to help them against workplace violence, advocating to unionize, helping them understand how to navigate strike procedures, really just being an advocate for nurses that's very much needed right now in this industry. And she's really looking to help to overhaul the system that has potentially helped and hurt so many healthcare members. So we're thrilled to have her on this call today. So we're going to get right into some of the questions and talk to her a little bit about some of the things that she's been involved in. So, one of the things we like to start off with is a statistic and kind of talk a little bit about what we saw from the data. A 2020 study from the American Nurses Association found that 44% of nurses reported facing physical violence at work. What do you think needs to change to make sure the hospitals and the clinic settings are safer for nurses?
Well, healthcare employers need to put their money where their mouth is. The fact is they just don't value nurses and healthcare workers' lives. That's the sad reality. And so they don't want to spend the money to invest in basic security measures like metal detectors. You're safer going to the library, going anywhere these days than you are going into a hospital. Very few hospitals have metal detectors, and the ones that do typically only have one at one entrance in the emergency room. And there's several other entrances that could be, completely unmanned and open to anyone and everyone 24/7. So that and security guards. You'd be shocked how many places they have security guards that are not armed and are not even allowed to physically touch a patient or an aggressor, someone that is attacking an employee. So they're rendered basically useless. Why are you there if you can't even touch and intervene? So we need armed security, right? We need things like panic buttons that are effective for healthcare workers, not just one at the nurse's desk, but one that we can carry with us that shows our location. We need locked security or locked doors to units where appropriate. And we need someone to be in charge of monitoring that door. It should not fall on the nurse. And that's what they do a lot of the time. So in addition to nursing duties, we now, if we're lucky and fortunate enough to have a locked unit, we now are in charge of answering the phone every time someone wants to push the button to come in and out all day long, over and over again, and screening them and asking who they're here to see and all those things. So that needs to be delegated to someone other than the nurse, and just support so that when and if we are the victim of an assault at work, and we are frequently, and it's not reported, we need to be encouraged to report it, to file police reports, because we are often aggressively discouraged from simply exerting what is our right as a citizen to file a police report when someone has assaulted us. We need to be supported with things like workers' comp. If we are injured at work, we need to be given time off and, all the things, but we're not supported in this area at all.
Are you seeing a rise in number of incidences against nurses since the pandemic and since COVID? I mean, is there just a public outcry against the healthcare community, maybe because they felt like they were maybe misled or didn't give them the whole truth about, what was going on with this disease? I'm just curious. Have you seen that, the years that you've been working in the industry?
Yeah, 100%. It's always been an issue, and it steadily increases every year, but it certainly skyrocketed at the beginning of COVID, and it has not gone back down, unfortunately. And so Prior to COVID, we were consistently year after year voted the most trusted profession for forever, for years and years. And that slowly changed, about a year or so into COVID. And we nurses became public enemy number one to a lot of people. And, visitor families were not allowed to come and say goodbye to their loved ones during COVID. They were not allowed to come and visit. And that is a horrible position to be in. And unfortunately, the nurse is the one that interacts with patients and visitors and family members more, disproportionately more than anyone else. And so we bear the brunt of all of their frustrations, their aggressions, their inability to process their emotions effectively. We are on the receiving end of that. And it's terrifying. There have been nurses and healthcare workers that have been murdered at work, not just once. This happens quite a bit, that have been sexually assaulted at work, that have been permanently disabled at work, pregnant nurses that have been so viciously attacked that they have lost their child. These things happen very often, and it's almost never reported on in the media.
I didn't start this off, but my wife is also a nurse, and so she did work at the bedside, but immediately got out of that, right? Because it just wasn't for her. And when you tell stories like that, I can definitely understand and see that can be something that, obviously you go in with good intentions to be in this nursing field and to come into a situation where people are trying to do you harm because you are that focal point for everything else. And you're right. I can remember my dad had went to the hospital a year ago for a procedure, and the only person we saw was the nurse mostly, right? And so
Yeah.
the doctor would come in 5 minutes, look at the
If
chart,
you're
barely
lucky.
looked at barely looked at my dad, and just what the nurse was like, not just asking about food, but just how they're feeling, giving us advice, keeping us as calm. If the doctor was late, she explained why. So it was just like they were the one that really was a connection for us to the healthcare system
Mhm.
than anyone else. And so it's a shame that we've seen things like this, escalate. When you kind of look at the, labor statistics numbers, they said the nurse turnover rates are about almost 20% annually. What changes do you think need to do for that hospitals, administrators, they can do to keep nurses, maybe that turnover rate to go down a little bit? Are there things they can implement?
Oh, absolutely. And first, I want to say that I think that number is really low. It's probably much, much higher than that in reality. But the number one thing they can do is nurse to patient ratios. So that means the number of patients assigned to each nurse. And that should be different based on the type of unit, the specialty. So, for example, in ICU setting, you should never have more than 2 patients per nurse. And sometimes it should be only one. But there's only currently 2 states that have mandated nurse to patient ratios. Two. There's no such thing
What
as
what states are those? Just curious. Are they like the
California has for over 20 years or so. And of course, they have nurses, and they have protections, and nurses want to work there and flock there because of it. And recently, Oregon became the second state. Yeah.
you would think
But
Florida? I live in Florida now. You
oh
think
no,
Florida?
Florida is one of the worst. I'm sorry to say, one of the very worst. People hear about the nursing shortage. Well, I'm here to tell you that the nursing shortage is not real. That is absolutely propaganda created by healthcare organizations to get away with using less nurses so
Mm.
that they have less cost and they increase their profit margins, right? We have well over 5 million nurses in this country. It consistently goes up every single year. There are more than enough nurses to fill every void in the country, every vacancy. Every nursing school is turning away qualified applicants every semester. Everybody knows nurses, right? Nurses are everywhere. We are, I believe, the largest profession in the United States. There is no shortage of the number of nurses. There is only a shortage of nurses willing to work at the bedside in what are extremely toxic and dangerous conditions. So the primary reason being no ratios. We know that for every extra patient that a nurse is assigned above their recommended ratio for that specialty, all of their patients have between a 7 and 10% increased risk of death or serious complication.
Mm.
So if you're giving a nurse, let's say 3 patients more than they should have for that specialty, that means that every single one of the nurse's patients have between a 21 and 30% increased chance of death or serious complication because the nurse simply cannot be in that many places, simply does not have the time to catch the little signs that we are trained to catch because we're not going to be there because we're pulled in a million different directions. So I don't know about you, but I don't like those kind of statistics. I don't feel comfortable myself or a loved one being in the hospital under those situations, knowing that, yeah, they could have an easily avoidable death or complication if only the hospital cared more about patients than they did about money.
Mm, wow, well said. I mean, from the business side of things, right? So I get it. I can see you're right. The biggest cost driver is labor, right? And so if
Mm-hmm.
you can get more nurses to see patients, that helps with that. And also, that hospital margins are, razor thin, right? They don't make as much money. Some don't. You're right. There's vast many that make a lot more money and have the margins for that. And not
Right.
to excuse that, but I definitely see that from the business side of things to understand why they may want to do that. But to your point, the opposite of that is, like you said, if you're not providing better quality, then guess what? Your star ratings are going down. The patients are, the CHAP survey is going down because they're not getting the quality care. And that absolutely affects your money, right? Because you're not getting those quality incentive payments so it's that delicate balancing act to your point. And if they kind of lean more toward giving the nurses the right ratios as recommended, I'm sure this has been by studies, right? That
Oh, yeah.
research
Tons,
this,
countless
and just
research
and then
evidence
they
based
can
studies.
probably get those measurements that they need to get incentive payments and keep the quality measures up high, and also prevent those preventable readmissions because patients probably weren't getting the care they got discharged prematurely, and then
Mm-hmm.
now they're back in the hospital in 30 days. And so now I totally understand that.
There's another side to that, though, that people don't realize is that there is no ability to bill for nursing services. And so that is why, yeah, I know it's shocking, right? So doctors, nurse practitioners, physician assistants, right? They can all bill for their services, even like physical therapy. But nursing is literally rolled into the daily room rate. So
Oh,
we are
wow.
as valuable as the pillow, as the plastic water pitcher. That's it. And so that is why we are kind of vilified by healthcare organizations because they see us as a cost drain because we are the largest workforce in every single healthcare organization, regardless of setting. We are. And so they are constantly looking at ways to cut that cost. And, they're going about it the wrong way and people are paying with their lives. But what we need is for CMS, Centers for Medicaid, Medicare, to develop a reimbursement model for nursing services. Nursing care is only getting more and more highly specialized and technical every single year. There is
Mhm.
no reason that we should be rolled in to the daily room rate. It's frankly insulting.
Hmm. I wasn't aware of that. I don't know if you saw some of the latest physician fee schedules, right? They're announcing new kind of CPT codes that can be
Hmm.
done at the clinic level. So they have CPT codes for principal illness navigators. So if you
Hmm.
just suffer from cancer or something like that, then there's funding for that to kind of fund individuals to help with that. They're starting to fund for caregivers, right? Caregiver training and things of that nature at the clinic level. And then also community health workers, right? So having like social workers help patients with navigation and food insecurity to kind of help them get the medications they need. So to your point, you're right. I don't see any CPT codes associated with maybe like RN below, right? Obviously, nurse practitioners, get.
That's different. Yeah, they're a provider. Yeah.
But the challenge with them is, right, they get 85% of the reimbursement of what the
Yeah.
doctor gets. So
Yeah.
it does,
Absolutely.
just what you pay someone is shows you their value to you. So, which we all know nurse practitioners probably do more than what the doctor does in most
Hmm.
clinics. So, a couple of things. I want to go a couple angles with this, but I want to get into like, what are you advocating for nurses, right? So, obviously, there's all these changes that need to happen. Maybe talk a little bit about your work because I'm just curious about this naturally because it seems like this is needed. And what do you see, if the nurses came together in the more unionized, right, in a more organized fashion? Talk about the positive change that can happen if that works.
Well, the main thing is we will have nurses in all these vacancies, right? Because, like I said, there's more than enough. nurses to fill all the vacancies. So if they implemented the things that they need to implement, there will be nurses where you need them to be. Okay. We need to obviously focus on the violence against healthcare workers, which we touched on, and the nurse to patient ratios. Those are probably the two most egregious things that we need to focus on. But there is also this lovely, I say sarcastically, new trend the last 3-4 years or so of criminally prosecuting nurses for
Mm,
basic medical errors, you know? And so why would you want to become a nurse now, knowing that if you make a basic human error, probably because you're understaffed and you don't have the resources, and you do the right thing and you report it, not only will you be fired, not only will you be reported to the Board of Nursing and probably lose your license, now on top of all of that, they are criminally prosecuting nurses and putting them in jail for making a basic human error when we are constantly set up for failure.
mm,
So why would anybody want to be a nurse these days? Kentucky recently became the first and only state to kind of reverse that and outlaw criminal prosecution of nurses, and that was a big win. But we need that in every state. That needs to be federal law, because here's the thing, it's something called just culture. So when a nurse makes a mistake, we need to be able to safely report it, right? We need to know that we can go to our manager, whomever, and say, hey, this happened. We can go to the doctor. They can order the appropriate treatment that's necessary for whatever the error may have been without fear of retaliation and retribution, right?
mm,
But we can't do that anymore. We can't. And so, what is the natural outcome? The natural outcome is that nurses don't report things anymore. Because why would you? Why would you, knowing they're going to throw you in prison and take your license, and maybe you're a single mom and all these things? Why would anyone report anything? And so let's follow that trajectory. That means that you, as the patient in the hospital, no one's going to know what happened to you. The nurse knows. No one
mm,
else is going to know. No one's going to order anything to help you. And we're not going to fix the system that allowed the mistake to happen in the first place, which means that that same scenario will reoccur to other patients, right? That is why just culture is so important. But that has been effectively thrown out the window, and now we are criminally prosecuting nurses. So
mm.
there's that. And then there is this just very retaliatory kind of cloud that hangs over the nursing profession. So you go to report a safety concern, like you didn't even do anything wrong. You're just reporting a safety concern to your manager. Well, now they're retaliating against you and you're seen as the problem because you're telling them that, hey, there's something here that needs to be fixed. They just want people to be robots and, you know, toe the line and not speak up. So we can't even safely report safety concerns. We can't do anything without fear of retaliation. And that culture, not only is it very toxic, but it is pervasive and it is actually encouraged within hospital and healthcare organization leadership. It's so common, and it is, you know, it's leading to a high suicide rate in nursing. We are just constantly set up for failure, and we have little to no recourse or support.
Mm. I mean, you made a good point. You said basically, especially go to surgery, nurse is the only one that knows the whole history, what's going on, what's happening when you're not around or when they're talking about you. Patients don't think about that. They could be your lifeline, right? To kind of
Oh, yeah, we
maybe
are. We're
save
the
your life.
last line of defense.
Yeah,
We
yeah,
are.
because you're right. If because healthcare is all about workflows, right, and protocols, and they're breaking down, it's up to the individuals to use their common sense to say maybe this doesn't make sense for this patient, right, or this in this instance. And but if people are just blindly following these protocols and workflows, and they're causing harm, and there's no incentive for someone to speak up, and especially in nurses. That's a
Yeah.
challenge. Look, I love movies and pop culture, and I was just thinking while you were talking, I was like, you know what? They have so many TV shows and movies. Heroic Doctors, right? The Good Doctor
Mhm.
or House MD, and then you look at the nurse side. There's a movie years ago called Nurse Betty. They had the TV show Nurse Jackie, and they were
Mhm.
a little negative. And it's just like, wow. I was trying
Yeah.
to think, is there any good portrayal culturally about a nurse, right? Unless it's a nurse that's doing something may unethical. And so, not saying that's giving rise to what you're seeing in prosecutions, but I think there were some podcasts about this, about some nurses that did some things wrong. But it does seem unfairly, they don't provide the good side of that sometimes, unfortunately. And I wish they did more of that.
Yeah, nurses are still, unfortunately, to this day, misrepresented and not portrayed accurately or in a positive way in the media, unfortunately. And, some of it's really entertaining. I will say that there is a YouTube series that someone created called Nurses Station, the series on YouTube. And
Okay.
it's short little, like 10-minute videos that an independent filmmaker has created. Those are very realistic. If
Okay.
somebody wants to, and it's actors acting it out, but it's a nurse that's writing it. So if anyone wants to see a realistic representation of nursing, look at Nurses Station, the series on YouTube.
Awesome. Great recommendation. So we talked before the pod. I work in the telehealth space. We do remote patient monitoring, chronic care management, and we kind of help patients with devices and management that remotely. And we have nurses that talk to patients via telehealth. Obviously, that exploded, during COVID because it was just hard to see patients. Talk about, your experience with it. And then what are your thoughts about it now, now that we're getting, somewhat back to normal?
Yeah, I definitely had to do that during COVID. I was working in hospice, and the majority of patients are treated in their homes, the majority of hospice patients. And so the first year or two of COVID, when we just really didn't know what was going on, it was precarious to go into patients' homes. They didn't want us coming into their home, right? And exposing the rest of their family and their safe home environment. And so we had to do telehealth, and it was necessary at that time. I personally am of the opinion that it is a very slippery slope, and it's dangerous because what they're doing in some cases is using like a remote nurse in hospitals where there's a TV mounted on the wall, and I'm sure you've seen it. And there's a nurse that's somewhere else at another location that can turn their camera on and communicate with you. Now, if they utilized that correctly and it was simply supplemental to nurse staffing, that would be fine. That would be helpful if we had them just come in to do maybe the discharge planning and education, or if a nurse needed a second RN to witness something, those situations. But unfortunately, what we're seeing is that they're saying, "Oh, well, we got you these remote nurses. So now we're going to increase your ratios, and you're going to have one or two more patients than you did before."
Mhm.
Anything that they can ever use as an excuse to increase ratios and use less nurses, they will do every single time. And so it's almost being weaponized against nurses, and it's not good for patients in every setting.
No, that's a fair point. I think we see it also, like I was mentioning about my wife and how we employ nurses. It allows flexibility for nurses that want to get out of the bedside, right? And they can
Yeah.
do something
Oh, yeah, it's a
different.
great gig for a nurse that wants to not be beaten down every day. Yeah, it's a great gig.
Yeah, and not to say, instances where we've seen patients, get a little egregious with their work verbiage and things like that. But to
Mhm.
your point, that's definitely a lot safer than having a patient in your face in the hospital. But so I think that helps, and we're definitely. But you're right. I think that's just the nature of just with administrator or owners and labor. I mean, you hear the similar stories around manufacturing, right? The robots taking manufacturing jobs, and
Yeah,
the advent of AI, artificial intelligence, right? There's rumors that
yeah.
they're trying to create that kind of AI nurse that can answer questions for their
Terrifying.
clinicians remotely. And we already know from a technology standpoint, artificial intelligence can hallucinate, basically make up stuff. And
Yep.
so, I just don't trust AI to, help me through my illness, right? Sometimes
Right.
because it may get it wrong, or there's not a human being that can, kind of feel, or have empathy for your pain. So yeah, I think that's always going to be an ongoing challenge. And I think more organizations should start thinking about that as technology becomes more prevalent. And I think I read somewhere AI, they said they're trying to replace like something like 300,000 jobs over the next several
Mm.
years. So,
Yeah, yeah, it's terrifying. I mean, it's one thing if you have a robot that's going to go fetch you a blanket or some ice chips, okay. But do you want this robot to do invasive procedures on you, on your body, on your loved one? Do you want this robot to be interpreting your test results, your lab results, not knowing what a nurse that has done and seen this 20 years sees? you know they're just going to go by a protocol, right? Well, this and this equals this, but a nurse is going to go, well, there's also this other thing going on that could be a component.
mhm. I agree 100%. So, wow, this is insightful. Any advice for anyone, nurses just getting into this field or starting out? Obviously, you're on the other side and you can kind of see some of the bad things, but what are you recommending to new nurses, right, who come up to you? What can I do to kind of be successful, in this new normal of healthcare? What do you tell them?
Yeah, I tell them a couple of things. One is that there will inevitably come a point where you are questioning your sanity because unfortunately gaslighting is pervasive. And so when you reach that point, just try to remember that it's not you, it is the system. It's not you, it is the system, right? Something like 18% of new nurses contemplate suicide their first year. Like, it's a huge problem, right? So we need to support them. But the other thing is, I tell them to go in with their eyes wide open. So that means knowing what your rights are as an employee, as a worker. Know what the labor laws are in your specific state. Know the policies where you work. You'd be shocked at how often management will say, oh, well, it's policy. You have to do it. And there is no policy.
Mhm.
So you have to really empower yourself. You have to know your policies, and you have to know that your Bible, above all else, above your employer, above anything else, your Bible is your state nurse practice act, your scope of practice. And that changes state to state. So every single new grad nurse needs to have a hard copy available on them at all times at work of your state nurse practice act. And understand that no employer, no policy can force you to do something outside of your nurse practice act. And they will try. They will try. So you need to be able to pull it out and go, oh, nope. According to section 7B, that is not something that you
Yeah.
need to empower yourself, educate yourself.
I love that. Definitely stay educated and be aware of what's possible, what you can or can't do. And, like you said, advocate for yourself. Even though you're new, you have to kind of speak up and not take that. So I love that advice for those entering a new field in general. So, Nurse Erica, this has been so insightful and, definitely really impactful for nurses, but also for practice managers and doctors that own practices. And so definitely, I think they'll take it to heart. What's next for you? What do you have coming up that you want to advocate and talk about?
Oh gosh, there's always things going on in the nursing world. There is never a shortage of corruption or stories for me to cover, but I talk about a lot of them on my podcast that I co-host. It's called Nurses Uncorked. We
Mm,
tackle all of the current issues, and you can find me on all the social media platforms at the Nurse Erica, and it's Erica with a C.
I love it. I love it. Well, everyone, thank you for listening. Hope you took something and took some insights from this, some actionable things that you can do to not only help you in your career as a nurse, but if you hire nurses, to have more empathy and understanding what they're going through and help guide them and help them get through certain situations that may be harmful to them. But also, let's go back to that time we were clapping the windows, right? When they came
Yeah,
home.
the
Yes.
pots and pans. What
The
happened?
podcast.
Where did
Yes.
that go?
We want to go back to that period. So, no, I've learned a lot. Thank you, Nurse Erica, everyone. Thank you for listening. Look, check this out. Let's all figure out how we can navigate this new normal of healthcare. Thank you.
Thank you for having me.